Hi, I'm Dr. Yu. I'm a facial plastic surgeon here in Beverly Hills, and today I wanted to share the experience of one of my beautiful patients, Marissa. She underwent rhinoplasty about 2.5 years ago, and when she first came to me, she came because she wanted to change a few things about the appearance of her nose.
When I had my surgery done, I specifically wanted to make the tips thinner and get more of a defined bridge.
I talked to her about the surgical options, and for her, I felt the best result would come from using cartilage from her rib, fascia from the left side of her temple, and an open approach. An open approach means an incision was made on the bottom of her nose to access all her anatomy and to create greater structure to reshape her nose.
So when I first got it done, I thought it looked perfect. I had no complaints about it whatsoever.
Marissa's surgery was 2.5 years ago, and her nose is healed beautifully.
I would take a selfie at 2 weeks post-op, a month post-op, 6 months post-op, and a year post-op. And I didn't notice the difference until really after a year. And I realized the sutures were gone, the scarring was gone, the bridge was more defined, the bulbous tip I no longer had. And I actually, if you look to the side, you can see that he kind of raised it up to have more of a feminine, softer look.
The areas that are most slow to heal include the areas of thickest skin, like the tip of the nose and around the nostrils. The great thing is, after a few weeks, her own blood vessels begin growing into this cartilage. There's fibrous ingrowth, and it becomes a part of her nose that's living and breathing, and that changes with her.
So when I first got up, I felt fine. I didn't have any, I wasn't nauseated or anything of that sort, but I did feel pressure, and that was just from the rib cartilage. And I think throughout the entire healing process, that was what affected me the most.
Marissa's surgery was 2.5 years ago, and she's healed beautifully. At this point, her nose is fully healed, and the changes that she'll see in her nose are the changes that will come that are age-related.
Dr. Yu, when I met him, I knew he was the doctor for me. From bedside manners to pre-op to answering all my questions to post-op, the entire way, there was no question that he was the doctor for me.
If you have any further questions, feel free to comment below, any suggestions for future videos, and be sure to subscribe.